Good afternoon, everyone. Welcome to the Simcoe Muskoka District Health Unit's web presentation, The Cost of Eating Well, Monitoring Household Food Insecurity and Food Affordability in Simcoe Muskoka 2023. My name is Kara Thompson-Ritzko, and I'm a public health promoter with the Health Equity, Health Promotions, and Communications team. Before we begin, I would like to acknowledge that today we are joining you from the traditional territory of the Anishinaabe Nation, specifically the Chippewa Tri-Council, comprised of the Chippewas of Beausoleil, Rama, and Georgina Island First Nations. I also acknowledge the Potawatomi of Moose Deer Point, the Mohawks of Wata, and the Georgian Bay, Moon River, and Barrie South Simcoe Métis councils in this region. The Huron-Wendat and the Haudenosaunee Confederacy have also walked on this territory over time. Ontario is covered by 46 treaties and other agreements as its home to many Indigenous nations from across Turtle Island, including the Inuit and the Métis. These treaties and other agreements, including the One Dish with One Spoon Wampum Belt Covenant, are agreements to peaceably share and care for the land and its resources. Other Indigenous nations, Europeans, and newcomers were invited into this covenant in the spirit of respect, peace, and friendship. We are thankful to be able to work and live in these territories. We are thankful to the First Nations, Métis, and Inuit people who have cared for these territories since time immemorial and who continue to contribute to the strength of Ontario and all the communities across the province. Acknowledging traditional Indigenous territories is one way to recognize contemporary and historical Indigenous presence and land rights. It's a small step towards dismantling the continued impact of colonialism and undoing Indigenous erasure in our everyday lives. Our presentation today will be delivered by Vanessa Hurley, public health nutritionist and registered dietitian with the Simcoe Muskoka District Health Unit's Chronic Disease Prevention Team. Vanessa has been the project lead for food affordability surveillance in Simcoe Muskoka since 2019. Vanessa feels strongly that access to nutritious food is a basic human right that everyone is entitled to. She looks for opportunities to speak about increasing household food insecurity rates as an important public health issue and welcomes opportunities to connect with others in this field of work. Thank you so much for your time and expertise today, Vanessa. We look forward to your presentation.
Thank you, Kara, for the introduction. The presentation will focus on two key topics: monitoring food affordability using the Nutritious Food Basket Survey. So we will go through the why and the how. Then we will talk about household food insecurity, our rates locally, our rates in the province, the impacts of household food insecurity on our health, the effective solutions, as well as Simcoe Muskoka District Health Unit's actions to date. Since 1998, local Ontario public health agencies have been mandated to assess and report on the health of local populations and describe the existence and impact of health inequities, as well as monitor food affordability at a local level using the Nutritious Food Basket Survey. In Simcoe Muskoka, we have been monitoring food affordability for a number of years, and we are pleased to be able to share the 2023 data with you. The Ontario Nutritious Food Basket is a standardized survey tool. It has been used by Ontario's local public health associations to monitor both the accessibility and affordability of foods by relating the cost of food to individual and family incomes. The basket measures the cost of basic eating that represents current nutrition recommendations and average food purchasing patterns. It is not a tool to guide daily nutrition intake or guide our purchasing decisions. The basket was revised in 2022 and includes 61 food items based on the 2019 Canada's Food Guide. There are more plant-based items, less meat, more whole grains, and less sugar and salt. The Nutritious Food Basket Survey, however, does not include a number of items such as highly processed, ready-to-eat foods, convenient snack foods, foods for religious, cultural, celebratory, or special dietary requirements or preferences, infant food or formula, takeout or restaurant food, personal care items, or cleaning supplies often purchased at grocery stores. So just those 61 food items. The monthly cost of a nutritious food basket for a family of 4 in 2023 is $1,225.74 for Simcoe and Muskoka, $1,224.22 for Simcoe County, and $1,268.90 for Muskoka. The reference family of 4 includes 2 adults aged 31 to 50 years and 2 children aged 14 to 18 years and 4 to 8 years. 2023 data can be compared to 2022 data, and when comparing to last year's survey, we do see a 5 to 7% increase in the cost of a nutritious food basket. Reporting only the cost of food suggests that the Ontario Nutritious Food Basket is recommended as a healthy way of eating. The basket is only an example of the foods that can be purchased to help determine benchmark costs of eating. Additionally, reporting only the cost of food suggests that the data may be used as a budgeting tool by individuals and families and implies that the cost of food is the cause of household food insecurity. It is important to always present the cost of food within the context of income to communicate that incomes are inadequate for many residents. We will present this information in the slides to come. While inflation, and in particular food inflation, continues to increase for most of Simcoe Muskoka, the inability to purchase food is not because prices are too high, but because people living with low incomes do not have enough income to cover their cost of basic living, including food. An exception would be those in northern and remote areas of Ontario and in some First Nation communities where the high cost of food, along with insufficient incomes, does contribute to food insecurity. These 10 scenarios show that for many of our Simcoe Muskoka residents living with low income, it is impossible for them to afford the cost of nutritious food and rent, let alone have money for their other basic needs. And for some, for example, a single person, they do not have enough money to even cover food or rent. The family of 4 with median income is the comparator here, and they spend about 29% of their income on food and rent combined. Year after year, we see the same pattern here in our region, and we all agree that things must change. The previous scenarios clearly show that no, food and rent is not affordable for everyone. People living with low incomes are experiencing household food insecurity, which is defined as the inadequate or insecure access to food due to financial constraints. They do not have enough money for food. Household food insecurity is a marker of material deprivation tightly linked to low income, limited assets, debt, and other indicators of social and economic disadvantage. The experience of food insecurity can range from concerns about running out of food before there is money to buy more, to the inability to afford a quality or balanced diet, to going hungry, missing meals, and in extreme cases, not eating for whole days because of a lack of food and money for food. Food costs are increasing. We see this in the news. We hear so much about it. We are experiencing it. Over several months at the end of 2022, Statistics Canada reported food cost increases of over 10%. These are rates that we have not seen since the early 1980s. Everyone feels the pinch of the rising food costs, but those living with low incomes do not have the money to afford the difference. Many local families and individuals find themselves experiencing the following. They're worrying about running out of food, eating foods that are lower in nutritional quality. They're eating the same foods for all of their meals and snacks. They're eating less food than they need. They're going without eating so that their children can eat. missing meals altogether, and again, going a whole day or several days without eating. Canada's Food Guide provides our dietary guidance, which is based on current global evidence about the connection between food and health. And it is unacceptable that so many households are not able to follow the healthy eating recommendations in Canada's Food Guide because they don't have enough money for food. Households who struggle to pay for food also struggle to pay for all the other costs of living. The compromises that food insecure households make because they do not have enough money include, but go far beyond food-related decisions. Many will choose to reduce the amount of money they spend on food or go without eating so that they can use it for other basic needs, of which there are many: medications, phone and internet, transportation, childcare, heat, water, and gas, just to name a few. Money is taken from the food budget for these items. According to the most recent Canadian Income Survey data at the public health unit level, from 2021 to 2022, 18% of Simcoe Muskoka households, or 1 in 5 households, said that they had experienced some level of food insecurity at least once in the past 12 months. This is not significantly different from the 18.7% of Ontario households that reported some level of food insecurity during the same time frame. Food insecurity is worsening in our area. In previous years, we had reported 13% or 1 at 8, and now we're at 1 in 5 households or 18%. In Ontario, food insecurity has increased in children ages 1 to 17, with about 25% of children, or 1 in 4, living in food insecure households. Nationally, we know the prevalence is the highest recorded in Canada's 17-year history of monitoring. From 2021 to 2022, rates increased from 15.9% of households to 17.8%, also 1 in 5 households. This is a marked increase from 2021, following 3 years of relatively unchanged rates. The increase amounts to 312,000 more food insecure households in 2022 than in 2021, most of whom are households with children under 18, homeowners with mortgages, and households in Ontario. Of the 312,000 more food insecure households, nearly half were households who owned their own home with a mortgage, and of these, over half were in Ontario. Household food insecurity among lone parent families are significantly higher than in other types of families, including more than double than what was experienced by couples with children and more than 5 times higher than couples without children. Household food insecurity increases significantly among households that rent their principal dwelling when compared with households that own their primary dwelling, with rates approximately 4 times higher among renter households. The Proof 2022 status report states, "We continue to see the same patterns of vulnerability to food insecurity as in previous reports. Low-income households, renters, households led by female lone parents, and households relying on social assistance or employment insurance in the prior year are most likely to be food insecure." Over half of food insecure households in this report were reliant on employment incomes. This infographic demonstrates some of our local data from our Nutritious Food Basket survey results, as well as 4 of our 10 income and expense scenarios, which helps to illustrate food affordability in our region. This infographic can be downloaded from our website and printed and distributed if needed. There's lots of additional data on household food insecurity rates at the local, provincial, and national level, so we encourage you to check out these links for more information. Household food insecurity is a serious public health issue that can negatively affect the health of individuals, families, and our communities at large. The physical and mental health impacts are significant. Living in a food insecure household is associated with a greater risk of developing a wide range of chronic and non-communicable diseases and mental health conditions, such as diabetes, heart disease, depression, and anxiety, as well as increased risk of poor oral health, infections, and injury. Children are experiencing food insecurity are also at greater risk of health problems, particularly mental health problems that can last into adulthood. Adults living in food insecure households are more likely to have difficulty managing their chronic conditions, not take prescription medications as prescribed due to the cost, have higher healthcare usage, and die prematurely. So certainly the health impacts are large and the public health issue is a serious one. Food insecurity, as mentioned, is a problem of inadequate income that cannot be solved by providing charitable food. However, we do have a long history of food charity in Canada, which has created a large network of nonprofit food providers, but there has unfortunately not been a reduction in food insecurity rates locally, provincially, and nationally. Food charity programs can provide temporary food relief for some people, but are not available or accessible for all individuals and families for several reasons, such as geographical distance, operational issues, supply, transportation, and of course, issues with stigma or personal dignity in visiting a food bank. Messages that promote food charity as a solution to food insecurity may lessen government efforts to take action on important income and policy improvements that will put more money in people's pockets. This is a really great quote that I liked from the Proof 2022 status report that states, "Food insecurity has been a long-standing problem in Canada, and it has now gotten worse. More action to reconcile wages, social assistance, and other income supports with the actual cost of living is needed to meaningfully address household food insecurity." To tackle food insecurity, we need solutions that support income adequacy, those that increase income and provide people with more money to meet their basic needs. And research has repeatedly shown that policies that improve the financial situation of low-income households reduce the risk of food insecurity. And just listed here are some examples of those effective solutions. Social assistance rates to match real living costs, which are indexed to inflation, which is the key. Basic income, affordable, attainable housing, lower taxes for those living with low income, and jobs with livable wages, regular hours, and benefits. Addressing household food insecurity requires a whole community approach to guide actions and find solutions that put more money in people's pockets. Not only does it affect individuals and families, but the community at large. So we do all have a role to play. So what can you do to help reduce household food insecurity in your area and to ensure more money goes into people's pockets so that they can afford basic nutritious food? These are just some of the things that you can do. So you can certainly learn more about household food insecurity. You can share your learning and raise awareness of the issue by talking about it with family, friends, colleagues. Speak out for change. As individuals and community groups, we can advocate to the various levels of government for policy changes that will lead to effective income solutions. And action can be simple. such as sending a letter to urge your political leaders to take action. And we also have a say when we cast our votes in municipal, provincial, or federal elections. We can look out and identify opportunities to collaborate with others in our community, and we can get involved in poverty or food insecurity work in our community as well. So what is the chronic disease prevention program doing around this topic area? Well, as you know, we annually monitor food affordability and household food insecurity rates in our region. We are raising awareness about household food insecurity as a serious public health issue in Simcoe Muskoka and how it is linked to a number of serious chronic health conditions. We are working with local decision makers and influencers, municipalities, task groups, food councils, coalitions, and community organizations on solutions that support income adequacy and reduce household food insecurity. Over the past several years, our Board of Health has endorsed advocacy for a basic income, social assistance rate increases, attainable housing, affordable childcare, and accessible dental care to support reducing inequities that cause household food insecurity. There are opportunities at all levels of government to make positive changes, and we are working more consciously with our partners to make positive changes in our communities. We welcome you to connect and collaborate with us at the Health Unit. And here we have included a link to our online form where you can reach us, or you can also connect with us at the number provided here, Monday to Friday during our regular business hours. And we would love to get started working with you on long-lasting solutions that target inadequate income. Here are some questions for further personal reflection, or if you wanted to have some discussion with friends, family, or those in your organization that may have viewed this presentation. We encourage you to share the recording and to get this important conversation going. Again, please reach out for more information or for any support. And we encourage you to check out some of the resources listed here for additional information. Thank you so much for your time.